Health is a critical component for persons with disabilities, especially because of our impairment itself. And the disability community have been advocating for inclusive healthcare and accessible healthcare systems at the state level and at the national level as well. As a result of our advocacy at the national level, the Department of Empowerment of Persons with Disabilities also worked with the Ministry of Health and Family Welfare, and they arrived at a draft standards on accessible healthcare services, which the disability community discussed at large, and we have been advocating towards a comprehensive and lot of adaptations within the standards. Which actually came through a year back, and I have also been working towards that, and I met multiple officials at the health ministerial level, and in that process I could also meet with the NHSRC and different other health departments and officials, and push the agenda on inclusive health services for persons with disabilities, because there is no disaggregated data available on persons with disabilities accessing health schemes, and also focused intervention on disability and health is kind of missing. And so we developed as a national advocacy group, and we worked towards that, and then we identified that the National Family Health Survey, which was looking at the maternal and child care of the entire country, and this survey in its NFHS 6th round has missed out on disability questions, and we advocated towards that, but the Ministry of Health and Family Welfare released a notification saying that it was decided at the Technical Advisory Committee, and so disability questions are left, whereas there is no person with disability or nobody from the disability community, no health expert from the disability community is involved in the Technical Advisory Committee, which we have been advocating earlier. The entire disability movement from the country have written to the Ministry of Health and Family Welfare on inclusion of disability questions in NFHS 6, and also wrote a lot of rebuttal letters. We campaigned with the parliamentarians, and they also supported us. They showed their solidarity on in being disability included in NFHS 6 and all that, but then ministry was very firm, and so the disability community have filed public interest litigations in 3 states, in Tamil Nadu, Kolkata High Court, West Bengal, and Bengaluru, Karnataka. So the case is in process, whereas the survey is also at the stage of closing, and at this point of time it is difficult to include disability questions, whereas our ask is to include it from the next round onwards and don't exclude in any further rounds, because when you are talking about different aspects like family health or maternal health, child health, or women empowerment, what about disaggregated data of persons with disabilities? What about mothers with disabilities? What about children with disabilities? What about women with disabilities empowerment? So these are the questions which we have been asking the health ministry, and the same points is being put up before the court also. Let us wait and see what the court ruling will be, and towards this we are also asking for including people with disabilities at the decision making level of the health ministry, to have nodal officers for disability inclusion, or to have committee for all 21 disabilities under the health ministry. So these kind of system, if it is set in place, then we can achieve some extent of inclusion within the health schemes and programs. I was also part of the Universal Health Coverage Global Platforms, and I was the representing the Global South for UHC 2030 platform from the civil society engagement mechanism, where the universal health coverage aspect is being deliberated a lot, and how civil society can take that forward in our own countries. And back in India, we have our government looking at Ayushman Bharat, and also the health and wellness centers at the community level, with which the disability community started advocating. We also started a national campaign on universal health coverage calling UHC for India. And at the state level also we have been advocating, and in Tamil Nadu, Tamil Nadu government have come up with a scheme called Makkalai Thedi Marthuvam, where medicines would be provided at the doorsteps, and also the treatment towards that. And right now people are getting treated for diabetes, hypertension, and a few other diseases at home, where we advocated to include disability services within the scheme. At the state level, we also worked through the State Advisory Board for Persons with Disabilities, and as a result of our advocacy, our Chief Minister of Tamil Nadu have inaugurated therapy vans, which would go to the doorstep of people with disabilities and get their physiotherapy and other rehabilitation aspects done. And so as disability community, what we have achieved is very, very little, whereas we have to focus more on this aspect, because without health there is nothing in life. So health is very, very important, and the disability movement should focus more on this and come together so that we can achieve a totally inclusive and accessible healthcare system in the country, and without any out-of-pocket expenditure by any person with disability.